Right, good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, April 11th, 2023. It is 4:32 p.m. My name is Ty Menser, Chair of the Board of Health. We have a full board here today in person. Board Member Robbie Vasquez to the far left, Board Member Gary Edwards, Board Member Commissioner Carolina Mejia. To my right is Maria Williams, Board Member Beth Harvey, and Board Member Lynn Nelson. So thank you all for being here, and I'm calling this meeting to order. First item up is to approve the proposed agenda for today's meeting. Is there a second?
Second.
Okay, it's been moved and seconded to approve today's agenda. Any discussion? Hearing none, all in favor, say aye.
Aye.
All opposed? Motion passes. Agenda is approved. Item 2 is the opportunity for the public to address the Board of Health. I'm not going to go through all the rules unless I know we have a public comment. Or is there public comment
We
today?
have someone
There
on
are,
the
there's someone
phone.
too.
Perfect. Okay, so the guidelines for public comment. Thurston County Board of Health welcomes comments from the public. There are a few guidelines governing such comments to make sure they are appropriate. When addressed or when introduced, please introduce yourself, including the area of the county in which you reside. Address the board, not audience or staff. Silence your cell phones. The board will not respond to public comment directly on an as-needed basis. The administrator will follow up with specific items at a later time. Speakers are limited to a total of 4 minutes to address the board. Meeting attendees cannot donate their speaking time to another speaker. The board reserves the right to restrict a person's opportunity to address the meeting for good cause. No comments that are lewd, offensive, inflammatory, hateful, defamatory, or discriminatory in nature. Please be respectful. No outbursts of any kind, comments that are commercial in nature, and any written materials will be considered public record and subject to public release upon request pursuant to the Public Records Act of the 4256 RCW. Finally, no remarks about pending land use permits or any similar matters that could eventually become before the board on appeal, which may or may not rise in the Board of Health. So you have it, and so let's start with anyone in the boardroom who wishes to make public comment. No. We'll go to Zoom.
Yeah, I'm gonna be calling based on the order that I have in my Zoom screen. First, I have MC McClear. Please go ahead, you have 4 minutes.
Great, thank you so much. Chair, Mentor, and board members, thank you for considering my testimony today. My name is Mary Catherine McAleer, and while I'm typically lobbying in the state legislature on behalf of my employer, Weyerhaeuser, I'm here today representing myself as a constituent and shellfish tideland owner. You may recognize me from a few shellfish-related items. In 2017, the County Commission appointed me to the Henderson-Nisqually Shellfish Protection Advisory Board, and in 2019, we brought you the Henderson Inlet Closure Response Plan. I was very much looking forward to being in person with you today, but I do have COVID, so I didn't think you would appreciate that. But regardless, I'm here to enthusiastically support the ongoing work of the Septic Operations and Maintenance Program and their upcoming ordinance change. My fiance Casey, our dog, and I live here in the paradise that is Nisqually Reach. We live here specifically because the marine water quality is superior to other inlets, so we can swim, kayak, and fish in the water safely. Nisqually Reach has some of the cleanest water in the South Sound, and there are 2 huge contributors to that, which I'm here to support today: shellfish aquaculture and the Thurston County Environmental Health Leadership and Water Quality Improvement. I was originally inspired to raise geoducks on a tour of the Lemmy Nation's geoduck hatchery, which, if you've never done, is an incredible honor, and I'd highly recommend visiting. As you know, a single clam on my 1-acre farm can filter up to 50 gallons of water a day, decreasing columnar hypoxia and filtering toxins. There are a few better places in the South Sound for sustainable aquaculture. Even old data estimated that our shellfish's value in this area is valued at over $53 million annually. As landowners and shellfish growers, Casey and I are committed to maintaining and improving the water quality of Nisqually Reach, so we welcome the kind staff at Thurston County Environmental when they come to administer dye tests. We also ensure they have a cold drink when they hike back up the hill because our access to the beach is only for goats. Staff have been courteous, professional, and timely, which they have to be because some of my neighbors are sort of hostile to the notion of county staff entering their households. But the environmental team has proposed an innovation that I am here to support. My understanding is that the O&M program rules will sunset in December of this year. So please renew their funding for one thing. And there is a new ordinance proposing a sanitary survey rather than dye tests every 9 years. The proposed sanitary survey would cost $35 less per site and would be less invasive to homeowners' indoor space. So we would hope that a less invasive approach would increase the number of neighbors willing to comply with these important studies for the health of our shellfish and shorelines. So as your constituent and Shellfish Protection District Advisory Board member, I implore you to support staff recommendations to continue the vital work of the Environmental Health O&M program and its dedication to ongoing improvement. Thank you very much for your time.
Thank you. Next, I have Brian Saraceno. Brian Saraceno. That will conclude public testimony, Mr. Chair.
Okay, thank you. Item 3 is a proclamation that we have today regarding Prescription Drug Take-Back Day. And we have Chris Hawkins, Program Manager from our Public Health and Social Services Department, to kind of give us a overview.
Good afternoon, Commissioners and Board of Health members. Thank you for taking the time to consider this proclamation on your agenda today. Proper disposal of prescription medications at the end of their use is a proven strategy to address both prevention of youth substance use and opioid misuse in our community. A high proportion of prescription drug abuse starts with drugs obtained from family or friends, and opioid addictions often start from using prescription opiate medications found around the house. Be that, the Bucota Tenino Healthy Action Team, which is a coalition in the southern part of Thurston County, and Tumwater Hopes are our local youth substance use prevention coalitions. Some of the members of those coalitions are here with us today. They've been collaborating with local police departments in Tenino and Tumwater to hold take-back events each of the past few years. And this has resulted, as an example, in last fall, in hundreds of residents being reached and 116 pounds of unwanted or expired medications collected at the cleanup drop-off event with the city of Tumwater alone. Every day can be Prescription Drug Take-Back Day because there are convenient locations for safe and secure disposal, and those options are available throughout the county and in most jurisdictions within the county at grocery stores, chain pharmacies, clinics, and local police departments. We publish and distribute a listing of those locations, which currently number around 30. Just passed around to the board some of those information pieces that we distribute. And we also have these signs being posted at the windows as you go into local pharmacies and businesses, letting you know that there is a prescription drug take-back box available there. We also promote this through the county's new website at thurstonmedicationtakeback.org. This is one strategy among several that are deployed by these local coalitions and our health department to aid in preventing substance use and associated harms, particularly among youth throughout Thurston County. Safe storage of medications at home is another important aspect of this. In recent years, these coalitions have also been distributing lock boxes and safe medication storage bags, hundreds of those being distributed just in the last year by the coalitions and by our department and the opioid task force. Poisoning is also a leading cause of unintentional injury-related deaths in Washington state, with analgesics, another word for pain medications, being a top source of that poisoning, particularly among young people aged 6 to 12 and teens. And so this strategy of promoting the safe disposal and appropriate disposal is a way of reducing that occurrence as well for our community. And finally, there are serious environmental consequences and impacts from improper disposal of prescription medications. Those can get into our drinking water through groundwater when they are flushed down the drain. So we want to encourage people to use the proper medication drop box facilities around the county. And this Prescription Drug Take-Back Day is a great way to promote that. It's available all year round. And we appreciate the board's time today to address this issue with this proclamation, raise awareness of those prescription medication drop boxes, and to go alongside events that are going on, one of which is being hosted by City of, in the Tenino area by BoH, trying to collect some medications on April 22nd of this year. Happy to take any questions or invite you to ask questions of the coalition members who are here as well, if you would like.
Can you introduce those coalition members?
I would be happy to. From the Bucota Tenino Healthy Action Team, we have Principal Rand Hodgson of the Tenino Middle School. And then from Tumwater Hopes, we have Angela Jefferson, the City Council member from City of Tumwater, and Shelley Willis of Family Education and Support Services, all of whom have been instrumental partners in not only this effort, but other efforts of those youth substance use prevention coalitions. Thank you for being here today, folks.
Questions for coalition members? Okay, very good. You ready for a proclamation then?
Great.
Okay, well, I will introduce it and then we'll have, we'll go down the line. So this is Thurston County proclamation regarding Prescription Drug Take-Back Day.
Whereas National Prescription Drug Take-Back Day is a day for every American in every community around the country to do their part to fight the opioid epidemic, prevent youth substance misuse, and help maintain a healthy environment by safely disposing of unwanted prescription medications from their homes.
And whereas the Drug Enforcement Agency launched a national drug take-back initiative in 2010 with the Environmental Protection Agency and the Food and Drug Administration, because expired, unused, and unwanted medication can be a public health and public safety issue.
And whereas disposing of unwanted or unused prescription medications safely, rather than throwing them away or flushing them down the toilet or drain, prevents them from getting in the water supply.
And whereas disposing of unwanted or unused prescription medication regularly prevents them from finding their way into the wrong hands.
And whereas Thurston County is facing an opioid epidemic, losing 153 individuals to overdoses in 2022, the majority of which were due to fentanyl.
And whereas we recognize this opioid epidemic has a serious health impact on individuals, families, and the community, with safe medication return disposal being a key prevention strategy.
And whereas in 2021, 2% of Thurston County eighth graders had misused over-the-counter drugs like cough medicine in the past month, and 2% had used medication not prescribed to them in the past month, often because it's easier to get and thought to be safer coming from family or friends.
And whereas helping people safely dispose of prescription drugs at no cost to local residents is one of the many important ways that our healthcare clinics, law enforcement agencies, and pharmacies are working together to reduce the impact of drug misuse, abuse, and overdoses.
And whereas our county government promotes national take-back days along with our local jurisdictional partners, including the towns of Bucota, City of Tenino, City of Tumwater, and our community youth substance use prevention, empowerment, and success, Tumwater Hopes.
And whereas the Board of Health supports implementation of the Washington state law that established a statewide system for safe and secure collection and disposal of medicines or drugs through a uniform drug take-back program, and encourages Thurston County residents to participate in safely disposing of unwanted or unused medication as a routine.
Now therefore be it resolved, the Board of Health hereby proclaims April 22nd as Prescription Drug Take-Back Day in Thurston County and urges all residents to participate and dispose of unused, unwanted, or expired prescription medications at a local safe disposal location. Adopted this 11th day of April 2023 by the Thurston County Board of Health. Sure.
I also wanted to acknowledge that a couple of the coalition coordinators couldn't be here today, but Stacy Everett is the staff to the Bucota Tenino Healthy Action Team, and Georgia Oust is the staff person who's the coalition coordinator for Tumwater Hopes. And they both had other engagements today, but they'll be continuing to provide great support for these coalitions going forward. Yeah.
To hold?
Yeah, it's right there.
There we go.
I don't think you can read it.
Squeeze it in.
That's okay.
Thank you.
We did it.
Good.
I will.
I just was like. Yes, you did. Okay, we'll move on to item 4, legislative update, to be brought to us by our Director of Public Health and Social Services, David Bain.
All right, we really had 2 items that the board was interested in, and think hearing about legislatively. One was on the nurse staffing bill, a lot of energy on that bill, and then there was a briefing from the Board of Commissioners on our healthcare systems. In that conversation, there was also interest in our Medicaid rates for long-term care facilities, and there was a bill related to that as well. So I'll actually lead with that one because it's the easiest. There were 2 pieces of legislation. There was a Senate bill and a House companion that did not pass committee by crossover day this past year. So this session, that bill will not pass, but just for reference, it's Senate Bill 5526. This bill essentially would have reset the Medicaid rates for long-term care facilities, and then tied those rates to inflation moving forward. Right now, the rates are not tied to inflation in any meaningful way, and you see a real serious staffing shortage at facilities who are unable to pay their staffing, and that creates a big backlog and the whole healthcare system within the state. So we'll keep an eye on that. So this is, things aren't fully dead. We'll see next year if that bill comes back again, but just keep an eye on that one. That's again, Senate Bill 5526. The other bill, which is a lot more complicated, was Senate Bill 5236, which did get passed and signed by the governor, I believe Friday, actually. There's a lot happening in this bill, and I will not try to get into the weeds, but just at a high level for you guys to have the concept. Basically, it puts in place an expansion of hospital staffing committees. It's going to require it to be basically a 50-50 split of nurse staffing and then administrative representation on these staffing committees. And there's some key escalators. So by January 1st, 2024, hospitals have to establish these committees. By July 1st, 2024, the committee has to actually put forward a draft of their staffing plan, their annual staffing plan, to their hospital CEO. And then beginning in 2025, each hospital has to submit its final staffing plan to DoH. And then they'll do that every year thereafter. So really, you won't really see impact from this for 2 years, just so we're clear about that. So this next year and the year after that, you're gonna see them putting in place the committees and the plans, but they actually won't be presenting those plans to DoH and being held by them until 2025. One of the key pieces of the bill is this idea that starting in 2025, if a hospital is in compliance for less than 80% of its nurse staffing assignment in a month, the hospital has to report that to DoH regarding what happened and why. There are different escalators here too, but basically at a certain point, DoH can actually, and L&I can have the authority to put in place different fines and penalties as part of a correction action plan for these facilities. There's also a creation of a statewide staffing committee that DoH and I believe L&I will have to kind of co-create as well. And that committee is the one that will receive those plans and sort of help evaluate them moving forward as well. So the impact to the county, like I said, it's really a 2 or 3 year before we actually see any real sort of impact there. Again, this bill was heavily negotiated between hospitals, the Hospital Association, nurse unions, And this was the compromise bill that came out of those negotiations and compromise. So both sides were engaged heavily in this bill. I think at the end of the day, hospitals being held accountable for these staffing ratios is really a key piece, while also sort of making sure hospitals can still kind of operate regardless of the circumstances. So I'll pause for any questions. I am not by any means a hospital expert. I wanted just awareness for you all because this does impact, our overall healthcare system. But just know that that bill did pass, and we're going to look at impact in the next 2 to 3 years.
Board Member Vasquez.
I'm looking at the Senate report, the legislative report on the bill, and it talks about reducing requirements for overtime.
Yeah, I should have gone into that. So, a couple things. It enforces the idea that nurses can't be first to work through breaks with a few emergency situations. And it also does say that no employee of a healthcare facility may be required to work overtime, and that if you do, it is a strictly voluntary process.
You have to consent to the overtime, so they're shifting away from mandatory overtime, which has been a pretty consistent practice in many medical facilities in the past.
Correct. Yeah, thank you for that. I was focusing on the other pieces of it, but that's a huge piece of that as well.
Board Member Mejia.
For 5526, in terms of the Medicaid rates, is it dead, or is it one of these like tied to the budget and that's
Yeah,
what?
so I was gonna say, to the best of my understanding, I wouldn't say it's dead, but I don't think there was a ton of momentum for it. So again, I could be surprised, and I would be happy to be surprised by that. But it doesn't seem like there was a ton of momentum there. But as you well know, Commissioner, this is the fun time of session where things that were dead will come alive again. So we'll see.
Is this, sorry, can I default?
Yeah.
Is this something where the Board of Health can write a letter to our legislators and kind of just outlining the need that we've heard out in the community in terms of Medicaid rates, not only from the hospitals, but as well as long-term housing that Chair Menser heard?
Yeah, I think that's a great suggestion. And I think even if we don't see it kind of go through this year's budget process, again, this is an opportunity for next session as well.
I'm going to give just a little bit of background on why I asked for this, because I met with a group of folks that run smaller long-term care facilities, and they were showing me the spreadsheets and the economics and saying that the Medicaid reimbursement did not make they were only surviving because they're basically doing most of the work themselves, and even though they had other jobs and stuff, and it wasn't long-term sustainable. Okay, so I filed that away. Then we had the Board of County Commissioners had a presentation from the two hospital, from Darren Goss at Providence and Bill not Calicote, it's the other director over at Multicare. But anyway, we're talking about the backlog within the hospital system. And one of those backlogs was because there aren't places to get people discharged to the long-term care facilities that the Medicaid rates aren't supporting. They're over 20 years old, those rates, is what I'm being told. So I thought that this would be something the Board of Health should hear about, and I didn't know where things stood with the legislature, which is why I asked David to report, because I didn't know, frankly. This was a couple weeks ago. So then the question was, if there was some momentum or there was something at the precipice, maybe the board would want to weigh in and support in some way or something. That's kind of, where we got where we are today.
And
Yes,
the
Board
other
Member
thing I would comment on, of course, over half of children in the state are covered by Medicaid, pays about 65% of Medicare. And this is impacting children's beds too, because of course hospitals can't fund children's care because it's not reimbursed adequately. So pediatricians tend to be pretty soft-hearted, and a lot of course, the women delivering babies also a lot of them are on Medicaid as well, so
And
it's a big thing.
what seemed complicated was that I'm just kind of repeating back what I thought I understood, is that this isn't just a rate. It's like there are buckets of rates. There's the rate that might be reimbursed for a long-term care facility, the rate that might be paid to a pediatrician, and those rates can be set, independently. So But what I was understanding is that all of them are quite antiquated.
Yeah, you can go across the board.
Across the board, there's a need to kind of update those rates.
Yep.
And I didn't know exactly what piece the legislature was working on, and you're saying it's long-term.
It was specifically to long-term care, this one. Now, as Beth Harvey pointed out, like there are so many other areas too where we need to see Medicaid rate increases. This is not a one-size-fits-all thing, but it's complicated. And it's of course, there's a fiscal commitment from the state when you're trying to do that, right? So the feds are giving us their rate. If you want to go above and beyond that, that is just pure state funding that you're putting in at that point. So that's also one of the pieces of the puzzle there. Yeah.
Board Member Vasquez.
Just on the topic of it's complicated, there's also like funding for midwifery services. And that's currently being proposed to be lifted because right now we don't pay midwives enough to continue doing business, either when they provide services in a birth center or when they're doing home deliveries. And so there's a proviso in one of the budgets and not in the other to lift the Medicaid rates. But yeah, there's thousands of different funding streams for Medicaid and different rates based on the circumstances. Like medical coding is a whole professional field because Medicaid is so complicated.
This was a little bit unique to see a bill that, I mean, really specifically carved out long-term care facilities.
Yeah, they must have heard from some of the same folks
Yeah.
that I heard from
Yes.
specifically about that issue. Well, I don't know if there's an opportunity or a way if there's anything that's alive enough for us to.
Yeah, I mean, I can have a couple of some sort of off the record conversations to see kind of where things stand and see if it's worth having a quick note from the board. But as a general rule, I think it would be great for the Board of Health to be able to weigh in on those kind of things.
Let me just put it this way, would the board be willing to contemplate if David finds an avenue for us to plug in support for that I could, as a chair, represent the Board of Health? Maybe it'd be an email, maybe it would be a phone message, maybe it would be a letter, but would that be?
What are you asking?
I'm asking whether you'd like to give me authority if in the next week or two, an opportunity comes in to plug in some support for one of these, that I would have to be able to do that because we won't meet again until next month. Okay. Board Member Vasquez?
Yes. Although I'm still gonna read the bill.
Yeah.
Yes.
Is there any chance we could tie this in some fashion? I'm gonna say a month or so ago, when I was talking to some of the folks from the hospital, there were 68 beds that particular day that were occupied by individuals that if there was a place to discharge them to, they would have been discharged. And the backlog process was affecting the emergency room and entrance to the system, I guess. So I'd like to see that we champion this cause, if you will, and also tie it in with it. It may help alleviate the overcrowding situation of those individuals that are in the hospital that could be released. So see if we can't tie that together, because it's affecting all the way back to our fire medical units and EMS people that are responding out there in the community because they're tied up. So somehow, if we couldn't put that all together and take that message in letter form or verbally by your representation to see if we can't get the legislature to recognize the importance of rates, because nobody is gonna go out there and take on a new business, for an example, if they don't have rates to support it.
Yeah, no, if I get that opportunity, I'll draw in some local numbers that we're facing here in we've got that information. County Manager.
Suggestion for the board, even if this bill may not have any legs this legislative session, that is something that perhaps sending a letter perhaps sets the stage for the Board of Health itself to help introduce this bill again next year and work with our lobbyists to make sure that we champion in a more direct way this particular bill.
Yeah.
But I think a correspondence is always good, and maybe I work with David to develop something. But if it's not this year, there's always an opportunity for next year. And that is so important that we should continue with the journey.
Okay, great, yeah.
And then I just wanted to say I had a patient that was literally in the hospital boarding for 3 months, waiting for a special bed and was on Medicaid, and that was
Well, yeah, we've been hearing about this from every quarter, just about. I mean, we had a chamber lunch that focused on it. We had a briefing directly to the board. I've actually asked the two folks that came and briefed the board to brief the Board of Health. And we were even thinking about trying to pull that together for this, but there was other things to deal with, like the Nisqually issue. But in an upcoming Board of Health meeting, we'll try to present that information directly through the local hospital CEOs. Board Member Vasquez.
This is more of a procedural question, not about these two bills, but about how we can engage on like political priorities for the Thurston Board of Health. I'm wondering if maybe in advance of the next legislative session, we can have a meeting agenda topic to review like what we've stated our priorities strategically are for the board and what we anticipate seeing from the legislature, so we can kind of be active during the legislative session instead of kind of coming in at the end. That's like for next
That's
year.
a good conversation. Obviously, the county and the city of Lacey has legislative priorities. That would be something if the Board of Health would like to have standalone legislative priorities, and we can work through that process. Or maybe those legislative priorities can be embedded into the county's legislative priorities. But having that conversation in the fall, certainly I think is a good idea.
The county, in most jurisdictions, will sort of develop a one-pager with 3 or 4 top things, and then we'll schedule a meeting, at least with our local legislators, and kind of go over it. And that's something the Board of Health, I don't see why it couldn't do that if it wanted to. So that's something we can think
Because in
about.
the county's legislative priorities, we have added public health related matters. So.
Okay. Anything else on this topic before we move along? All right. Very good. Thank you, Dave. Item 5, Board of Health Fiscal Subcommittee appointments. We addressed this briefly last meeting, and Clerk of the Board of Health.
Yeah, we had 3 volunteers, Board Member Williams, Board Member Vasquez, I'm sorry, not Vasquez, Nelson, and Board Member Harvey.
Okay. We appreciate your willingness to serve. We need a motion to appoint those members. Is there a motion?
I would move to appoint Board of Health members to the Board of Health Fiscal Subcommittee.
Second.
Okay, motion's been made and seconded to appoint the stated members for the newly created Board of Health Fiscal Subcommittee. Any discussion? All in favor, say aye.
Aye.
Any opposed? Motion passes. And so next steps on that, Jamie or David, would be an
Yeah, I'd
email
love to
that would
work
set up schedule, or?
Scheduling, working with Robin Campbell and her fiscal team as well, and just making sure that those schedules align. But yeah, I'd love to have a first meeting. Really, I would love to something in the next month. We'll look at calendars, but that would be ideal, especially as we're moving into our budget process in the county. It would be an ideal time to sort of start getting some conversations happening.
Robin always warns us that the budget process starts earlier than you remember. It seems like things get going for us in July-ish.
Things are well
Things for you
underway by
going before
July.
that. But I mean, it's when the board level
Right.
starts to see those heavy discussions on. And so we'd like some preparation from the subcommittee for that. So that kind of gives you a flavor of the schedule. All right, thank you. All right, well then let's go on to item 6, which is kind of our weighty topic for today. It's the Nisqually Reach Septic Operation and Maintenance Program Renewal Issue. We have Jane Mountjoy Venning, Senior Environmental Health Specialist in our Public Health Department. Jane, you've got the floor. We've got your slides. And
Can you hear me okay?
Yes.
Okay. Well, you introduced myself, which is speeds things up because it's a long name and a long title and a long department. So we're here to talk about the future of the Nisqually Reach Shellfish Protection District and the operations and maintenance program, the septic operations and maintenance program. Next slide. Do I have it?
I got you covered.
I'm not used to the new room, where to look. So today, we're just going to kind of briefly go over what the three options that staff have come up with, give a little bit more background about the Nisqually Septic Operations and Maintenance Program, and then go into a little bit more depth with discussion, with the idea of getting some feedback from you as we move forward. Next slide. So we do have three options. We're kind of calling them the status quo option, which is what you would think. The sanitary survey option, which I'll describe in more depth a little bit later. And then, of course, the sunset option, which is what will happen automatically on December 31st this year if no action is taken by both the Board of Health and the Board of County Commissioners. Next slide. So again, just to refresh, when we were here last, when the nurses were here presenting, so it's interesting that that's come around again. The Nisqually Shellfish Protection District became a thing because the state health found that the marine waters had degraded enough in Nisqually Reach that shellfish beds were closed. So that triggered the need to form a shellfish protection district and come up with activities to improve the water quality. So one of those recommendations was a risk-based septic operations and maintenance program, and that's what we've been doing the last 10 years. Next slide. So again, it's, we've been going 10 years, and we sunset this year, at the end of this year, unless actions are taken. Next slide. So the goal of the program has always been to reduce pollution from septic systems in order to improve the water quality. And what happens in the program is all of the septic systems in the program area, the Nisqually Reach program area, are required to have regular septic inspections. Typically, it's every 3 years. Some are every 1 year, depending on the kind of septic system. In addition, if there's deficiencies found, there's some maintenance that's needed, pumping is needed, there's some repair that's needed to be done, that has to happen, and they have to be fixed so they're functioning properly. The program calls for the county to actively look for and identify any failing septic systems, and again, ensure that they are repaired and functioning properly, or connected to sewer if that's an option. We divide them into low-risk septic systems, which are most of them, and they require the regular inspections. The high-risk septic systems, which tends to mean waterfront, marine waterfront, or along Nisqually or McAllister Creek, require the inspections plus a dye test currently every 9 years. Next slide. So the criteria to decide if the program is successful or not was to, number one, maintain water quality in the approved areas. So we didn't want to kind of throw the baby out with the bathwater while we were focusing on fixing something over here, let something that was that was clean get worse. So got that. Number two is to improve water quality in the downgraded and unapproved areas. And number three was to increase the number of systems with regular inspections and maintenance. And on all accounts, next slide, these have all been a resounding success. Nisqually, 90% of the homeowners with septic systems are in compliance with their operational certificate. They've had their inspections, they've pumped if they needed to, they've taken care of any maintenance problems. It's interesting, I don't know how well you can see the two other slides. The top one is looking at minor repairs. So again, most systems require an inspection every 3 years, so the program kind of goes in 3-year blocks of time. If you look at those early years, we had a lot of minor repairs that were needed. And we still have some every year. Somebody needs a minor repair, but you can see the volume of that has really decreased as people are regularly inspecting, regularly pumping, taking care of minor things before they become big problems. So we feel like that's a success. And then the one below, with the little bar across, is the average level of scum and sludge, or the solids in the septic tanks for all the inspections that year. So we require pumping when the solids are a third of the volume of the tank, and that's what that red line is. So again, early in the program, the average volume was generally above that pumping line, and since people have been getting into regular maintenance, we've stayed below that. Again, individuals will have needed to pump, but overall, we're doing a great job. So we feel really good that the septic systems are in pretty good shape. So how does that translate to the water? Next slide. Is we're doing great. We have not had any downgrades in Nisqually Reach, and we have gained back 127 acres of shellfish growing area. So we've improved water quality in the inlet or in the reach, which is great. And next slide. The other thing that's kind of interesting, too far, that one, is all of the marine stations, and it's DoH, Department of Health, that does the marine water monitoring. All of the stations are meeting the bacteria standards for shellfish harvesting. We still do have some areas that are closed. There's other things that also impact whether or not you can harvest shellfish in an area. Can you go back one slide? For example, that big red area down at the bottom, that's the wildlife refuge, so we're not gonna harvest commercial shellfish there. Up at the very top, there's a little inlet that's red, that's Zittle's Marina, and that's a mandatory closure around marinas. So it's really those two little red dots kind of in the middle there, the upper middle, that we're really focusing on trying to improve. And the stations there currently are all meeting water quality standards. There's some other issues in the area that they're looking at, and that may be able to be upgraded in future years. Okay, skip ahead 2. One more. There we go. The other thing is we are seeing trends of better improving water quality at 3 stations that have been of concern over the last few years. So that red line is the standard for, is it meeting the bacterial water quality standards or not? So right now, all 3 of those are below, so they are meeting the standard, so that's great. One's just right there. But the other 2 are well enough below that they're actually below the threatened line, which is that gray line. So again, we've been improving water quality. We don't have any stations showing a worse trend. And finally, what's really great is we've had these improvements in water quality at a time, this 10-year period, when the population in the area has increased by about 35%. The number of septic systems has increased by about 11%. So it's really kind of remarkable that we're able to make improvements in the water at a time when there's more potential for pollution to get into it. And that's really hats off to all the people living out there who are doing their part to take care of their septic system, get the pumping done, get the maintenance done, probably also picking up the dog waste, et cetera, et cetera. So that belongs to the people who live there.
Can I ask a quick?
Yes.
On this slide, it says number of NRWPA OPCs. Can you tell me what that means?
What's the secret code?
Yes.
Nisqually Reach Watershed Protection Area is part of that, and then the OPC is our shorthand for operational certificate for the septic system. Thank you.
And these numbers is that within the reach area, or is that countywide?
Yeah, that's what it's based on census data, and census data, of course, doesn't exactly match the watershed protection area, but it's pretty close. So that the closest we can get, that's what it looks like.
That's just the watershed area. Countywide, there's about 55,000.
Oh, yeah. No, we're even higher.
Yeah, I was just looking at the percentages. Yeah.
Yeah, the population of the septic system increased within, closest we can get to the watershed protection area. More accurate on the septic systems than on the population. Okay. Questions? All right, shifting to the options that we'd like feedback on. So the secret decoder ring for the colors is if it's green, we recommend it for all options. The blue is the status quo option, and the yellow is or orange is the sanitary survey. And of course, sunset is, you don't do anything, so that's pretty easy to describe. So for all options, we would recommend continuing these program elements that we already have. So that we would continue to require operational certificates for all the septic systems in the program area. Again, they need inspections regularly, they need to take care of any deficiencies that are found, and they must not be failing. We have to continue to manage septic system records. We'd like to continue to provide financial aid options and riser rebates, and I'd like to say a little bit more about those. Financial aid comes in a couple different flavors. If septic owners are on the assessor's senior disabled tax relief program, then they're not charged for the septic operations and maintenance program. Everybody else it's a line on their property tax assessment. In addition, we have always had paid for out of other funds, but we've always had low-income small grants available where it's up to $500 with a cost share that would help people to have pumping done or small repairs done or things like that. And that's really critical because there are the people that just really can't afford that. And pumping's gotten expensive. It's about $500 average, I would say, to have your septic system pumped. The riser rebates are available to everyone. There's not an income cutoff for that. And what that does is, if I don't know who's got a septic system or seen one, but it brings the lid of the septic system up to the surface. It's those green lids you see, very attractive in the landscape. And all you have to do is unscrew them to get in there and inspect and take care of it. Otherwise, they tend to be buried. You have to dig up maybe 3 inches, maybe 1.5 foot of soil, and then lift these really awful heavy lids. So this makes it, when you have that, it's really hard to get in there and inspect it. So having these lids makes it much easier for folks. And then third, this is a statewide program that is teamed up with an organization called Craft 3 to offer clean water loans for failing septic systems. When anybody has a failing septic system, they can go into that program and get favorable rates and conditions about getting their septic system repaired or replaced or hooked up to sewer. So those are really important. Otherwise, we also would like to continue offer technical assistance and quality assurance, quality control types of checks. So that we'd recommend for everyone. We'd also recommend a few program modifications, kind of using that adaptive management strategy. And this would be for everyone. We would like to require professional inspections at least once every 9 years. So currently, you can have your septic system inspected either by a professional, or if your system qualifies, you can take our class that we offer to become certified to inspect it yourself. And that's a good program. I think it gives people a lot of good information and ability to understand what's going on and understand the importance. And I think that adding this gives another layer of assurance without really creating a lot of hardship. Nearly every septic system would need to be pumped within a 9-year time frame. And so the professional's already out there, having the professional do a full inspection and turn that into the health department gives us just a little bit more assurance that things are going well. Next thing we'd like to do is that class I mentioned has traditionally been paid for out of the rates and charges from the shellfish protection areas, Henderson and Nisqually, and that class has only been available to the people living in those areas. Now that we have the foundational public health funds, with your blessing, I guess, or permission, we have expanded that county-wide using the foundational public health funds so that everybody in the whole county who has a system which qualifies is able to take that class and become certified to inspect. And I love that. And so therefore, equity-wise, it doesn't seem quite fair to make the people in Henderson, Nisqually pay an extra fee to have that class that everybody else gets from the Foundational Public Health Fund, so we'd like to just shift that over. Third, we'd like to require a written diagnostic report on the cause of a septic failure. It provides a good feedback loop so that we can see where there's weak points. It gives us ability to do a little more troubleshooting, a little proactive education, kind of see what's going on. It also helps when we have failures that can be resolved with a minor repair that doesn't require a permit. It gives us a little more assurance that that repair that's being done is likely to take care of the problem. So that's a slight shift. And then the last one is kind of a bureaucratic one. Currently, the rates.
Move forward the slide, we covered that.
What?
Page 15.
Oh, I'm sorry, jump ahead, I got so excited. Sorry, you guys. Yeah, that last piece is any rate changes that would happen, annual rate changes, which currently are tagged to the June Consumer Price Index. We'd like to shift it to the April Consumer Price Index because that's what all the other rates and charges and fees are based on. So that would just make it.
Jane,
More
I'm a little
straightforward.
confused. These proposed modifications,
Yeah.
would be then, how does that fit into your status quo versus sanitary survey
This is still,
dichotomy?
this would be for everybody. We would still recommend these changes for everybody. There's slight changes to what we're already doing, but we would recommend it either status quo dinked with a little bit,
Okay.
or for the sanitary survey.
Okay. Yeah, gotcha.
Then the next slide is where we're looking at the more significant change, is for the high-risk properties, and in Nisqually Reach, we're talking about 335 currently. We're looking at either the status quo option or the sanitary survey option. Status quo would be to continue to do dye testing on each property once every 9 years. The sanitary survey would instead have everybody have at least one dye test, an initial dye test, and then shift to doing a sanitary survey, which is a site visit where we would look over the septic system. We would still talk with the owner and, give them maintenance tips. We have an ability to take water samples from the property and, also while we're there, talk about animal manure issues. And then really only if there was cause for concern, high bacteria results in the water, or a mushy drain field that we're like, that doesn't look good, or whatever it might be, then at that point we would go to a dye test. So pros and cons on the status quo. It's, we know it's effective. We've been doing it. It works. We find failed systems each year. It's got a high level of community acceptance in part. Everybody has to have it done, so everybody knows it's not just them, it's them too, and they might not like to have theirs, but they sure like that their neighbor does. So there's some of that. The con is, it is pretty staff intensive. Each dye test requires 4 visits to the site. And, we do come inside the home, we pour dye in the toilet and down a sink, so, we're right there. And it's a little more expensive because of that level of staff involvement. The sanitary survey option, the pros there are it's less expensive. It's not quite as invasive because we're only coming inside if we need to. The cons is sort of an unknown con. We don't know if the community will feel like that's a good idea or not. That fairness issue is important, and people want to feel like they're being treated fairly. So that shift from everybody has to do it to everybody has to have a survey, and then if it seems like you need one, we're going to give you a dye test. So we think that will work, but we want to check. Questions?
Yeah.
Board
Well, I
Member,
was just,
Board Member Edwards.
okay, as we move ahead, in the Henderson watershed, we did address those situations where people were not paying and hooked up somehow.
Yeah.
Art knows all about, I can't remember exactly
Yeah.
what it ended up being, but there were some freebies going on.
Well,
there.
yeah, and we fixed that to
And
make
we
it
fixed that
match.
for Henderson, but did we fix that for Nisqually?
we made Henderson match Nisqually. So based on what we knew about Henderson, because Henderson was first, when
Yeah.
we first put Nisqually in place, we made some shifts so that that was different. So.
I guess is everybody now paying, if you've got four homes on your one property, you're paying 4 times as much?
No. They are paying, the first septic system pays the regular rate, and then each additional pays a $10 for each additional septic
And I
system.
guess I'm still questioning why that is, why we're, because there's trailer parks out there that have
They have a lot,
70 or 60 or, systems.
yeah.
And they've got separate systems apparently. Why aren't they also paying the full rate? Because when we talk about like a cost for a property owner dye test and it's gonna be $760, I don't wanna do that. I don't wanna, from my perspective, I want everybody to pay their fair share and spread the wealth, so to speak. And I thought that's what we did over in the other district.
Yeah.
Didn't we do that, Art?
Yeah, we did that, it's the structure, the microphone.
Yeah, so we can capture the conversation now.
So I'm Art Starry, the Environmental Health Division Director, and along with Jane, I've been working on these different projects for quite a while. And the question that Commissioner Edwards brought up, as Jane indicated, when this first happened in Henderson, we had a flat charge for every lot, regardless of how many septic systems were on there. And then we realized that when there were multiple septic systems on the lot, it took a lot of time to do the record keeping and the monitoring and stuff. And so we adjusted. So we basically learned from that, and when we developed Nisqually, we created a kind of a base charge and then an additional charge for each additional septic system on the property. And we thought that more or less covered the cost necessary to implement the program for that. And so we think it's pretty close, and that's what happened when the Henderson was renewed. We then used that same structure. So it's as Jane indicated, there's a base charge and then there's an additional $10 charge per septic system. So that's how we move forward with Henderson. And when we renewed Henderson, and that's what's Nisqually. So we think that it actually may not completely cover costs, and so that's something we can look into, but that's the way that program was set up. So we addressed the problem, and maybe there's some fine tuning, but that's where we ended up with that.
Okay, I guess I'm taking up too much time. Go ahead.
Septic system stuff, isn't everybody love it? I mean, we could talk for hours. Okay, thank you. I'll let Jane have control again.
Okay.
Other questions?
Yeah, go ahead.
This is a 101 question. so
Sure.
Forgive me, but what constitutes a high-risk property? And certainly they're not limited to Nisqually Reach. And so is there consistency
Right.
across them?
Yeah, we have criteria that are put out. So the high-risk properties are within, I believe it's 200 feet of the marine water, and you get a certain amount of points for that. And you have particular soils that are not great at septic systems. So you get points for that, and if you get enough points, then you're a high-risk system. So what it, in practicality, comes to is the marine properties pretty much all have lousy soils, so, so they're high risk. And then if you're along, in Nisqually Reach, along McAllister Creek, you have that. In Henderson, again, it's marine properties, and then along some of the other creeks or drainages. Basically, if your system fails, it's got a higher chance of pretty quickly getting into the marine water and causing a problem for the shell. Well, it doesn't hurt the shellfish, but it hurts us if we eat the shellfish.
So are the criteria consistent across all of those?
Yeah,
Okay.
yeah.
So if you did the sanitary survey and you're expecting the $450 cost, but then you're like, oh no, we have to do a dye test on this property, then you would just bump the $760. That wouldn't be like on top of that.
Yeah, to do the budgeting, I put assumptions in, of course. So how many, when you're doing a regular dye test, how many samples do you have to send to the lab, and how many water samples do you take? Same thing on the sanitary survey version. I figured, I think 5% or 10% or something would need a dye test. So that cost is factored into that figure.
Oh, okay.
Yeah.
It's actually less expensive
Yeah.
overall.
Because as Commissioner Edwards was saying, we don't come to a dye test and say, give us $750 or whatever. It's into the rates that they're paying annually.
Oh,
And again,
okay.
those dye tests only happen once every 9 years, so it's just a little fraction.
Yeah, excuse me. Remember Edwards. I have a question. So the types of problems that you discover in a dye test, speculatively, I know this is a speculative question, but what percentage of those problems are you going to be able to determine through the sanitary survey, and what percentage is going to be undetectable? You're not going to see it based on all the things you
Right.
do at the sanitary survey. How much are we going to miss?
Yeah.
And do you have a sense of that?
I don't have a great sense of that, so there is a chance we might miss some. And that with the dye test, those packets are out there for 3 or 4 weeks, catching any dye that might come through. In a sanitary survey, we're gonna take, a sample of bacteria, or of water to test for bacteria. So we may miss something, but I think we'll catch a lot of it because we don't always take water samples either. So we'll be guided more by the water that's coming down to get into the beach, or, in a stream leading to the beach. So we'll see that. What we may miss, some of the seeps in the hillside, we'll look for places to collect water, but sometimes that's easier to find with a charcoal packet, than it might be for a water sample, although to declare something a failure, currently we need both the water sample and the dye combined, so we would have to get a water sample. Sometimes, we refine dye, and for whatever reason, we can't capture enough water to test for bacteria. So we let the homeowner know, and sometimes they do take proactive and, have a look at their septic system and do some diagnostics and fix something. So there, yeah, we may miss some of that. I think that we'll be pretty close to where I think I don't think we'll risk the water quality as a whole by shifting.
Would it be fair to say that if you do miss something, it's going to be the more minor things, and the more major types of failures would be detectable through your sanitary survey process? Or is it just or is that not right? It's really the kind of failure.
Yeah. The ones that are more concerning for the water quality in the marine water, I think we would catch because of, if you walk along the beach, there's any number of drainage holes and streams and whatnot that come down. So we'd be collecting water from those spots. So if you had a failure, and the septic system was the property was on the marine water, but the septic system is way back there in the field, and it fails, but the bacteria don't get all the way out to the water, we might not catch those where we would have caught some dye up here. So, if there's water up there, we could take a sample, but sometimes there's not. So it's a balance.
What are the chances of properties not being at high risk? And if we were to go to the status quo, they would still have to pay $760.
I'm not sure I heard you all the way, I'm sorry.
So what are the chances of properties not being at high risk? And if we were to go through the status quo, do they still have to pay $760?
So if somebody was not high risk, but they are failing, would we find them? Is that?
No, would they still have to pay $760 if you were to go through
Oh.
the status quo?
No, currently the rates are, if you're low risk, currently today, your low risk is $71 a year. Your high risk site is $168 a year. Again, plus $10 if you have extra septic systems. If you're a community system, so multiple systems that are connected, or a food establishment or schools, they have a higher rate of $181.
So the
that's
$760
annual.
is for the whole 9 years?
Yeah, so
I see.
that estimate is spread out in those rates that are charged each year.
Thank you.
You said if it's a low-risk system, they don't deal with the dye testing at all.
The
said
low risk
inspection
don't get
only.
the dye test, no. They do have to have it inspected every 3 years or every 1 year, depending on the kind of system, and turn those results into us.
And I know Art and I have talked about this, and am I right in saying that while we don't monitor it the same way, there's, anyone with a septic system is supposed to, by state law, have an inspection every 3 years.
That's true.
So we're not asking them to do something they're not really
Right.
already required to do. We're being more focused on compliance with that.
Yeah.
Okay.
I just learned something new.
Yeah. Any other questions? Okay, keep going. I guess you have more.
Okay.
There's more slides.
I
according
just
to my
got one
packet.
more slide.
Okay.
The other ones were my secret hidden ones in case you had questions. that I
Okay.
can show you. So next slides, our next steps was to provide updates to the Board of Commissioners, solicit additional feedback, particularly about the options from both our Shellfish Advisory Committee that our, Mary Catherine sits on that committee, and also community partners and residents in the area to see how they feel about it. If everybody thinks we should move ahead, then we would prepare draft ordinances for both the Board of Health and the Board of County Commissioners. There needs to be a public hearing and then action by Board of Health and Board of Commissioners to adopt any program that we decide to go forward with.
And if we give you a thumbs up on that today, what would be the timeline for all those steps? When would we be seeing the draft ordinances? And
Yeah, I mean, if you give me a thumbs up today, and I don't know how we're interacting with the Board of Commissioners and the Board of Health, if we can kind of jointly do it, then we could get moving pretty quickly on getting feedback and have draft ordinances by late summer, mid to late summer. I'd like, because it sunsets in the end of December, and if we continue, because it appears on the tax rolls, we need to get that information into the assessor's office or treasurer's office by November, so I'd like to back it up from there. That's it.
all you need?
Okay.
We just want to make sure that you're aware of this, because as we start engaging the public, we thought you might be getting questions, you might have concerns. We just wanted to make sure that you're aware of what's going on before we start stirring the pot.
No, this is good. I learned things about this that I didn't know as well. So I think this was good information for all of us. All right, thank you. All right, let's go to item 7, Health Officer's Report. Dr. Alcoholic, welcome.
Good evening, Board of Health. I just wanted to update you a little bit about some of the communicable diseases that are currently circulating in Thurston County and provide a few updates. So first off, starting with COVID-19, our community level is low. And our transmission has fallen in the past month, from high to substantial and is now moderate on the CDC transmission dashboard. On this Washington State dashboard, we're at 30.6 cases per 100,000 over the past 7 days and 82.8 cases per 100,000 over the past 14 days. Just thinking a little bit about our healthcare capacity with regard to COVID. Using CDC data for the week ending on April 8th, we've had 2.1 hospitalizations per 100,000 over the preceding 7 days, and 3.3% of our inpatient beds are currently occupied by COVID-19 positive patients, and 2.7% of our ICU beds. So that's actually much lower than it's been early on in the pandemic. So although we are seeing transmission in our community, we're not seeing significant healthcare impacts due to severe disease at this point. The current dominant variant is XBB.1.5. So that's a highly transmissible variant, but again, we're not seeing a safety signal, so we're not seeing an increase in hospitalizations or deaths. So as the pandemic has changed, you know, there are a number of measures that are also changing. So the Secretary of Health's masking order, which covered healthcare facilities, long-term care facilities, as well as correctional facilities when community levels are medium or high, has been rescinded. And so, and that was as of April 3rd. So what that means is that although masks. So Thurston County does recommend masks in healthcare settings. However, they're not required, and each facility is able to make an independent determination of whether or not to require masks in their facility based on, you know, infection control measures, you know, the community they serve, and factors of that nature. We also have been meeting, we also met with with our colleagues at the Thurston County Correctional Facility, including Sheriff Sanders, who attended remotely last week, just to talk about COVID-19 infection prevention and control measures at the facility. And we were impressed by the way that the jail leadership is really looking at the safety of folks that both work in the facility and are detained there. So just wanted to share a little bit about that. The national COVID-19 emergency ended yesterday. So that was a little bit ahead of schedule. So there are, you know, our COVID-19 mitigation measures, they aren't, some are on an on-off switch, but most of them are more on a gradation. So while there are, you know, changes coming down the pike in terms of, you know, who's going to pay for COVID-19 tests, although for the record, we do have state-provided tests that are available for, you know, folks in our county. So thinking about folks in the highest risk settings like our houseless shelter population, our correctional facilities, as well as identified outbreaks with vulnerable populations that don't have, you know, other ways of accessing testing. But we knew that some of these testing things are going to sundown with the end of the emergency. And as we move forward, there are pieces of the COVID-19 response that were tied initially to the federal emergency that may be picked up or addressed by in other ways. So through state partners, through as well as other means. So as we move forward, we're still learning about what all the specific impacts are. For folks that do have questions about something specific, feel free to reach out. You know, just, you know, if folks are, you know, there's a overall trend towards commercialization for COVID-19 treatments and vaccine that we're anticipating seeing throughout the year. That's not necessarily tied specifically to the emergency. So in summary, the national COVID-19 emergency has ended. We're still we're more on a dimmer type situation as far as kind of COVID-19 response. So watching, so really responding to risk and community need. And with that, there are a few other pieces and parts, but I wanted to pause here and see if there are any questions or anything that I could answer for folks.
I have a question. I'm noticing a trend downward. Actually, you call it out in here in ages of people who are diagnosed with COVID-19 now. Is that also national, or is that something unique to the Northwest?
Oh, in terms of the ages of folks?
The age of diagnosis, yeah.
So overall, sorry, I guess I don't have an answer right now off the top
Okay,
of
I
my
was
head,
just
but I'm
curious.
happy to check what the national trends are as far as age and get back to you on that.
Do you have any idea what that's attributed to? Is it just this variant or?
So we aren't really seeing, so some of it has to do with who's getting tested.
Oh, okay.
And so like, because we do a lot of testing in schools to detect, detecting outbreaks and it's screening, that's a trend that we've seen. And then there's also a greater kind of viral respiratory burden in children and younger, and folks in younger age groups
But
as
if
well.
I'm reading this right, it's like age 20 to 40, where there's
Pardon?
higher numbers of cases, correct?
So yes, and that has been so sorry, in terms of COVID-19, and the age groups that have been at highest risk. So through looking throughout the pandemic,
So it's not a change.
it's folks that are working. You know, so you're looking at your 20 to 40-year-olds
So not a
overall.
change necessarily.
No.
I had a question, Dr. A, about the jail. So you weren't very specific. I mean, did whatever you and the leadership at the jail kind of worked through, is that going to result in their being able to book more people? I mean, that was kind of their concern, is based on the structure of our jail and the requirements, they had to really restrict who they could book in, and that meant certain kinds of warrants weren't getting booked and certain kinds of property crimes weren't getting booked. And is that going to be relaxed now based on the conversations you've had, or where are we at on that?
So the kind of the constraints around booking are multifactorial. In terms of in terms of the COVID-19 impact, those impacts really have to do with kind of that intake screening process, as well as isolation of folks who test positive at this point. What we did when we came together at our meeting was kind of talk through like what are what the parameters were, and we're moving away overall from a setting of public health orders and directives to public health recommendations with regard to COVID-19 infection and control. So we've talked through the piece of COVID-19 mitigation, and we have some thoughts and some steps moving forward on the public health side of things from that meeting. And I, as always, appreciate the collaboration with our jail leadership.
Chair, I was there as well. I mean, I think to be even more sort of blunt about it, like the public health component of this is purely recommendations at this point. So the jail leadership team, it's going to make their best decisions on their risk and how they want to approach that, and they're going to work with us to make sure that we're giving them good advice and recommendations. But at this juncture, it's not our authority that's forcing an intake process. Now, if there's an outbreak, they still have to report and notify us of outbreaks, and we have some steps there. But in terms of that intake process, our role now, and Dr. A said really well, which is we're here to support them and give them what we think are best practices, given trends, given situations. But that is not a thing that is held under Dr. A's authority for that intake process at this point. Just so we're clear about that.
Got it. Board Member Mejia.
I want to thank both Dr. A and David for setting up that meeting and going through this with the sheriff and the jail staff. I'm guessing their staffing you mentioned that this is a multifaceted kind of issue, and I'm guessing staffing is one of the reasons as well on the booking. And so with this new recommendation, right, we've heard this quite a lot, that public health has been setting the guidance and that, so I guess what I'm trying to say is that's not going to be the case anymore. And us as a Board of Health, right, if that is brought up, we can comfortably be
this is not a public health directive. They are simply recommending at this point, but the sheriff's office in his capacity and his leadership are making those decisions on how to approach.
Yeah, I would say at the end of the day, they're going to be decision makers about how they want to handle their intake process.
Okay.
They're relying on us to give them good advice and recommendations on protocols and procedures. And I wanted to note this really quick too. They've been really great partners. Even the short time I've been here, I've had several meetings with that group, and they are so committed to the safety of their staff and of the folks who are incarcerated. And so we're here to give, again, recommendations and advice as they seek it from us, if that makes sense. So again, anything they do moving forward in terms of how they want to handle their intake process and all the factors that go into that for them is something that is ultimately on their end. And again, anything else is from us, is a recommendation or advice. So that is an accurate statement.
With one exception, and that is outbreak control,
Yep.
which falls under the duties of the health officer. So at that point, when there's a COVID-19 outbreak, I do give direction on how to mitigate that outbreak. But with regard to the other components, there's a role for health officer recommendations to the jail administrator, and we're transitioning into that capacity.
Okay.
And in terms of our age and trends, I will get back to you on all of that in terms of how it reflects what's going on in the state and the country, and I can share that out. In terms of, we're not seeing a whole lot of other viral respiratory illnesses. Flu rates are minimal for week 13. In the past, in some years, we get a flu B bump at about this time. We're not seeing any signs of that, but both flu A and flu B were reported in the past week. So we're still watching out for that. And the only other piece that I just wanted to mention is that we are seeing clusters of acute gastrointestinal illness in our community, so in schools and long-term care facilities. Largely thought to be viral, and we haven't seen, a spike in other enterics like, Salmonella, Shigella, kind of the other bacteria that we would be worried about there. And so lots of change coming our direction as COVID moves from pandemic to endemic and kind of fades from the foreground to the background. But I think right now it looks like we're in a pretty good spot, and we're always happy to help folks in our community kind of navigate this transitional period.
I'd like to give the floor to David, our
Yeah.
director, to kind of bring us home.
No worries.
We got a couple items.
I'm standing between you and the end. I realize that. So I'll be as brief as I can be. Dr. A said, I was going to highlight that as well. Just a great meeting with the jail staff, and just a reminder that COVID isn't the only intersect with the jail team, right? So there are other notifiable conditions or other factors that go into how we can support that group and that team. And so we're looking forward to moving forward in a sort of post-COVID environment. We'll continue that relationship. And I want to just kind of highlight again how excited I am to work with the sheriff and with the rest of the leadership team there on that. One of the things that came up in our agenda setting and has come up recently a couple times was a request for an update on our pilot program for temporary food. We came before you guys with a proposed sort of policy on pop-up food vending. And I wanted to sort of just give you guys a quick update on where we're at and then some of the things that we're hoping to do moving forward. My hope is that our team will have the policy ready to go for the public in the next month. One of the key pieces, and I'm going to give a shout out to Commissioner Mejia for facilitating this, is we're having a chance to meet with interested vendors. I believe it's next Monday, for an opportunity to talk through any final suggestions, concerns, ideas from folks before we move to a final version. So the team will take that feedback into consideration as we finalize our policy. The goal would be for us to notify the public of the change. Again, I'm hoping for May, depending on the feedback we get. And then have a ramp-up process so that by the summer, say like July, folks will have some time to kind of get ready, get acclimated to this new option. In the meantime, we are still operating under that temporary pilot program that you guys initiated, I believe it was last year. And as folks have interest, we're still accepting folks who have interest in joining the temporary program. There's a pretty straightforward process with that. Vendors who are interested in that, need to contact our food service program. There's a pretty simple permitting process there, but just know that we haven't ceased the pilot program. So that's still in existence now, and it'll move forward going into the new policy being up to date. I know there's been some, I think, concerns from folks, I think, who weren't kind of clear about where they fit into that policy. And I would say, again, contact the food service program, get your application in. It's a pretty quick turnaround for folks. If we don't have a permit on file, I can't do anything with that. So I need folks to sort of apply. But that policy, that temporary policy, is still very active. Like I said, we're hoping for that transition to happen from this to the permanent one this summer. And I'm looking for, see, 1 minute left.
Meeting's adjourned.
I really was wrapping up, I promise. And like I said, the feedback from folks will be really great. I also had a great meeting with Jenica Machado, who's obviously in our economic development program at the county. And we're talking about making sure that we have good outreach to the business community as we're ramping up for this policy to become permanent. So that was my 3-minute update on that, but I'm happy to take any questions from the board.
Public questions? No. Commissioner Ian, I've been hit with some, situations that kept us on task on this particular topic. Okay, anything else? Director Bain?
I think you have a new member of your executive team that you may want to.
Yeah, so I was gonna end on a high note. So as of, let's see, the 27th, Jen Freiheit joined us, and she moved all the way from Wisconsin to come here. So we got to introduce her to this wonderful weather we're having here in the Pacific Northwest. So I'd like to have kind of Jen
Say
come
a
up.
few words, introduce yourself.
Yeah, no
give a little
pressure.
Background to the board members.
Yes, hi, thank you. I'm Dr. Jen Freiheit. I come from Wisconsin, have worked in state and local public health for over 20 years there. So I understand all the environmental. I found it very fascinating, the septic. I'm very into that. But no, I have all the experience with local and state governmental programs, policy and advocacy, strategic planning, workforce development, leadership that I have done for 20 years. I come out here because my family's on the West Coast, and so it was time to come back closer to my family. And so I'm very excited to be here and all the opportunities and things that are happening right now. So thank you. I'm still onboarding and learning and hoping to meet everybody and hear what the issues are. And I am in Mr. Menser's district, so that's where I have found my new home.
All right.
So thank you.
In your position is assistant director.
Assistant director, yes, sorry. I should have said that.
Yeah, I don't think anyone said that. Which is a new position,
Yep.
so we're thrilled to have you. Thank you.
I'm
Thank
thrilled
you.
to have her too.
We'll be a good team. We'll work hard and serve you. Thank you.
Welcome aboard.
Thank you.
All right, well, that brings us to the end of tonight's agenda. Anything else for a good order? We're good.